Good morning. So today you will be taking notes again on the second portion of this lecture. As always, you should be taking your notes on line paper, clearly writing your name at the top, and then titling this History of Healthcare Notes Part 2. So again, you can use the back side of your paper from yesterday. You can continue on it. Just make sure that there is a clear distinction between yesterday's notes and today's notes. So yesterday we talked about holistic healthcare. We talked briefly about the difference between a pandemic versus an epidemic. And like I mentioned yesterday, I'm sharing with you guys what I was taught in my medical program when it comes to the spread of infection, things like that. So again, never trying to push my own beliefs down your throat. But again, I'm trying to speak from a scientific background, a medical background, that sort of thing. So today we're going to focus on some other diseases, and these were at the time pandemics, not pandemics, but epidemics in the area that they were. So typhoid is a disease that was, and these diseases now, some of them still exist. Some of them have been eradicated, like smallpox, which we'll talk about in a moment. But just know that back in the day, these were diseases that were fatal for people, and a lot of it had to do with the fact that there still wasn't that huge connection between hygiene and making sure that you are washing your hands, things are treated correctly. So like with typhoid is a type of bacterial infection that basically is found in water sources. So it's common in more third world countries just because their water is not treated the same way as it is, their drinking water is not treated the same way as it is in America. So we obviously know now that water should be purified, things like that, in order to consume it. But back in the day, they didn't have the same also technologies to purify water. And so people would obviously need to drink water to stay alive, and then they would get sick. Cholera was another condition. It was something that affected more people like in the 1800s, 1900s. It is a disease that you don't really see today, but it did kill people too just because we didn't have the same types of advancements in medical treatment. Malaria is a disease that is still it's still occurring today. It again is in third world countries. So if you travel anywhere in a third world country, they will often recommend that you take anti-malarial medication. So I actually went to Tanzania, which is a country in Africa, in 2014 for a school trip in college. And so prior to that trip, I had to get a bunch of different vaccines. I had to take anti-malarial medication. And so I didn't get malaria, but because they have such a issue with like mosquitoes, which is how malaria is actually spread, it was just important to make sure that you took that medication because I obviously have never been exposed to malaria in America, but if you're in another country, you could potentially get it if they have it there. Dysentery is a type of nutritional deficiency. This is something that was common more like 1600s, 1700s. You might have heard about it when you're studying like Christopher Columbus. People who were coming over in ships were actually suffering from dysentery. Leprosy is a type of disease that we don't typically see in like America. It's something, again, that's common in more first or third world countries. But this is a condition where basically people start to develop different sores and lesions on their skin. So like one of the things that I guess is kind of, I mean, it's not a good thing to have leprosy, but because you can physically see the lesions, the cuts, the things like that that are developing, it's easier to decipher if someone is, has that disease or not. And then smallpox, you've probably learned about this in maybe world history if you've taken it before, but smallpox, it's in a sense similar to chickenpox, but you basically develop little bumps all over your body. It can cause like a really high fever. So a lot of people who develop smallpox back in the day would end up dying due to like complications with maybe having a high fever, that sort of thing. So that's where way in the past, average lifespan was 25 to 30 years old. So for you guys, you might be like, wow, that's still kind of old because you guys are super young. For me, I would basically be dead because I'm around this age group. So 25 to 30 is not very old, super young. And so now, obviously, we have the awareness of hygiene. We have the awareness of just protecting ourselves consuming clean water, our modern medicine, that sort of thing, has basically eradicated the majority of these diseases, or we're able to treat them now. In 2014, there was an outbreak of Ebola. I'm not sure if you guys remember this because you guys are probably very young, especially if I have any freshmen or sophomores in this class. But prior to COVID-19, Ebola was probably the last time that we had a potential chance for a pandemic. So this didn't turn into a pandemic. It ended up, I think, infecting maybe only 5 people in America. I'm not 100% certain, but it was something that I remember. I was in college at the time, just kind of being a little bit fearful because Ebola, if you're not aware of it, it can cause you to basically hemorrhage from different orifices in your body. So people with Ebola can hemorrhage from their eyes, which hemorrhaging, if you're not aware of, is just bruising or bleeding. So they could be bleeding from their eyes. They could be developing bruising all over their body, which could indicate internal bleeding. Sometimes they'd be bleeding out of their nose, their mouth. It causes like a super high fever. You have a headache. So again, this was something it's still something that exists, but at that time, because there were so many cases, we hadn't had cases like that since I can remember, that it was very scary. So thankfully, Ebola did not turn into a pandemic. COVID-19 is obviously a pandemic right now, and it's still something scary, but Ebola is something that's definitely more lethal. I think with COVID-19, depending on what country you're in or what part of America you're in, I think the fatality rate is about like 5%, whereas Ebola is much, much higher. So if you were to develop Ebola, yes, you could live, but the likelihood of you living is going to be lower than something like COVID-19. All right, so back to different cultures that you guys will be learning about. So the Romans, they were one of the first actually develop sanitation. So it wasn't just that you were just drinking any form of water. They actually were able to have a major water source. And then they used aqueducts, which are like little, kind of think of it kind of like a gutter, but it was a way to basically bring cleaner water, more sanitized water. It's obviously not going to be the same as water sources today that we have in America, but from one spot, and then you would just be streaming to different parts of the city. And then they also believed that, again, cleanliness was important, so they actually established laws to create clean streets. People actually would go to the restroom in the streets, so usually people would have, let's say, like a bucket next to their bed. They would go to the bathroom in that, and then they would dump that into the street. That's what they were doing back then. And then they realized that this is something that's unclean. So they tried to do things to obviously keep the city sanitary. And then also the first hospitals and home visits actually occurred during this time as well. Renaissance. Renaissance, I'm sure you've learned about in world history if you've taken it. I think in history, when I was taking it, they were focusing on how it was the rebirth of art, but it was also a big rebirth of just advancements in medicine and just curiosity. So Da Vinci, I don't know if you've ever seen this image, he was fascinated with the human body, Leonardo da Vinci, and so he actually drew this image, and he was fascinated with dissection, which is when you cut into body parts, and just trying to figure out what their function was. So prior to this, there wasn't a lot of information on this stuff. So it was just, there were a lot of people in the Renaissance that, and you guys will be learning about this potentially on your own time, but a lot of people in the Renaissance that basically were trying to discover more about the human body, how it worked. So it wasn't just a focus on art, but it was a focus on science as well. And so because of this, because there's more education, more science-based things, lifespan actually increased from the 25 to 30 years to now 30 to 40, which still is relatively young. But again, they are progressing. During the 16th, 17th, and 18th century, several major advancements in medicine occurred. So you have the invention of the microscope by Anton von Leeuwenhoek, and I probably mispronounced that name. But the microscope is important because you were able to study cells. You were able to see things that were naked to the eye, and actually, be aware that even though you can't see something, things like bacteria exist on surfaces. They exist on wounds, things like that. Drugstores were created, medications were created. So again, this is very general, and you will be learning about this more in depth when you work on a project that I'll explain on Wednesday. But just know that vaccines also were starting to be created. So the first vaccine for smallpox came out during this time. And then again, because of all these advancements, lifespan has now increased from, let's go back to the 25 to 30 years to now 40 and 50. During the 19th century, again, more advancements, you have the invention of the stethoscope. You also have this lady named Florence Nightingale. She is known as the founder of modern nursing. If you've ever had a family member that was a nurse, or maybe you've gone to like a nursing graduation ceremony, they still basically pay tribute to Florence Nightingale. So she is like the super important person in nursing. So I don't want to give too much away because you will be learning about it a little bit more on your project, like I mentioned. But just know that she's known as the founder of modern nursing. And then you have Louis Pasteur. He believed in pasteurization, or he created pasteurization. So if you ever look at any of your dairy products, this is very common on dairy products, you will see pasteurized cheese, pasteurized milk. Pasteurization, what it is you heat up something to a certain temperature, and once you heat it up to that temperature, it then kills a lot of bacteria, viruses, things like that. And so that was one of the ways that you were able to establish infection control, because you were able to get rid of those little microorganisms that could potentially cause disease and illness. And then you have Clara Barton. She's the founder of the American Red Cross, which I'm sure you're well aware of. Like the Red Cross, we have a club on campus, and then I believe they do come at least once or twice a year for you to donate blood. But again, yeah, American Red Cross, they're not only blood donations, they're there for disaster relief, that sort of thing as well. But she is the founder of that. 20th century. So a lot of advancements happened during the 20th century. So just keep in mind, 20th century means 1900s to 2000. So during this time, there was X-ray invention, antibiotics were created. So like penicillin was invented. Treatment was actually given for certain diseases. So we're completely steering away from that belief that diseases were caused by demons and evil spirits. We now know that's not the case. And so there's actual more modern medicine treatments, IVs, things like that. The first open heart surgery was performed during the 1900s. 20th century, sorry. Computers were obviously invented, and they have definitely advanced from even when I was in high school. But yeah, the invention of computers has definitely helped to advance the medical field. And then because of all of this, we now have lifespan increases to 60 to 80 years old. And then there was also now the creation of healthcare plans. So healthcare plans are important because now you're not paying out of pocket to go to the hospital for all of your services. You basically pay into this. And at your age, you probably aren't even thinking about this, but I actually had to go to the hospital at the beginning of coronavirus. It wasn't because I had coronavirus, it was something completely unrelated. And I have healthcare through teaching. And so when I went to the hospital, I think when I got my bill, it was about $10,000 worth of services. But I only had to pay $100 from my copay. So health insurance, you pay into it like every month. I pay into mine every month. And then depending on how much money you pay into it, then that means that you don't have to pay as much of the actual service amount. So healthcare plans are super important. But again, I'm sure you guys aren't thinking about that because you guys are super young. But yeah, 20th century, rapid growth in healthcare. Like I mentioned, you have the x-rays, you have medicines, vaccines, things like that to help eliminate disease. The WHO is an organization that I'm sure you're aware of now, especially with coronavirus. But they're responsible for basically monitoring health problems to prevent, this says worldwide epidemics. They're also responsible for preventing worldwide pandemics. So the WHO they worked together when this whole started to basically try to tell other countries that, hey, we're noticing this outbreak that's occurring in China. And I keep using coronavirus because it's something that's obviously relatable, but there's this outbreak that we're noticing in China. And then giving them kind of a preparation, giving other countries basically a heads up so that if they need to shut down airports, which I know US did after they realized the severity, to help basically prevent further spread. I would say by the time that the US, though, was shutting things down, like cruise ships and the airports, it was kind of too late at that point. But that's why it's so important to have that collaboration with other countries. 20th century, so you had the discovery of not that we didn't know what DNA was, but there was more just research behind it, discovering the different components. So in my class, I don't expect you guys to ever memorize all of this stuff. If you plan on taking like microbiology, maybe if you're taking AP biology right now, you'll have to understand these different components. But they basically discovered that DNA carries genetic information, and then they used how it carries that genetic information to kind of help in researching how to treat different cures. So your DNA can tell markers as to whether or not you're more susceptible to a certain disease, if you're missing like a certain chromosome, that sort of stuff. It's able to basically, give you a lot of information about yourself. 21st century. So this is kind of where we're at right now. There's a threat of bioterrorism. So I'll talk about this later on, but bioterrorism is something that obviously we hope never happens. And again, I'll talk about it more. But when we get to that with infection control, but there is a chance that somebody could potentially get a hold of a certain virus or bacteria and then use it as a type of weapon. So if you ever hear bioterrorism, it's just talking about that. There's still obviously a threat to new viruses. We're currently dealing with that right now with coronavirus. You guys are, I'm sure, well aware. Anytime a new virus comes out, so like corona, if you've heard novel coronavirus, novel means that it's a new virus, and then corona is just the way that the virus is shaped. But if you ever, again, hear about novel viruses, novel is new, and new viruses are harder to treat because we just haven't had that background with how to treat it correctly. So that's where right now there's that struggle. We still haven't figured out a good treatment plan for coronavirus. There are things that work for some people, they don't work for others. And then we still obviously don't have that vaccine either. So until we have the treatment, the vaccine, or we have enough people that have had it and have recovered, this is obviously going to be something that we're dealing with until we get to that point. And then talk about the WHO. Transplants are something that we are obviously doing. So heart transplants, lung transplants. You just have to keep in mind that even though we have this modern advancement with being able to transplant organs, there's still a risk because you're putting something foreign in your body. So oftentimes with transplants, people have issues with their body actually rejecting the organ that they're getting or they are receiving. So they're usually on a lot of medication. Obviously, lawsuits are occurring. I'm sure there's going to be plenty of lawsuits for different hospitals with staff members that got sick and died with coronavirus, patients that maybe got sick and died. But yeah, that's just something you have to worry about. That's why there's liability insurance. I have liability insurance for me as an athletic trainer. Aging population. So there will always be a need for healthcare workers because we will always have people that are getting sick. We have people that are continuing to get older. As you get older, your body obviously starts to break down. So there will continue to have a need for healthcare. And then healthcare costs, I kind of talked about that when it comes to your healthcare plans, that sort of thing. You guys will be learning about these different things too. So there are different reforms that they have come up with. So you have home health care, which means that now you can receive health care in your home. You don't have to go to a hospital. There's geriatric care. So this is care for elderly. I know you guys like to use the term boomers. That's where it comes from. Boomers are people that were born during the baby boom. And so these people were born in like the 1950s. And now they're about 70. Some of them are a little bit older. And so the care for them. OBRA is an important act that you will need to know. It's just Just make sure you know that it's for nursing homes and home health. So it just establishes regulations for those. Telemedicine is something that is newer, but now again, you don't have to go into the hospital or go visit your doctor in person sometimes. There's certain times where you obviously need to have procedures done, so you do need to see the doctor in person. But if you just need a consultation or a follow-up appointment, often they're now done over video or audio. And then there is this focus, I kind of talked about it a little bit yesterday with holistic stuff, but it's important to not just be open to modern medicine and medication. You need to also focus on you just preventing your illness. So being healthy, exercising, eating well, decreasing your stress, doing things that are good for your body versus just relying on a quick fix like a medication. I think that's actually it. So, like with other notes, just make sure you guys scan them using CamScan or any free scanning app and then upload it to Classroom. And then if you have any issues, obviously reach out and I will see you guys tomorrow.